Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The month of September is the Sickle Cell Awareness Month. It's the month where experts raise awareness and give valuable information as regards this disease called sickle cell anemia. You're welcome to the second part, the second series of this interview with our sickle cell experts in studio. We have Dr. Kasirye Philip, who is a senior pediatrician at Mulago National Referral Hospital and the head of the Sickle Cell Clinic. Welcome back to the show,
Thank
Dr.
you.
Philip.
Thank you, Dr. Darius.
Yes,
Hello, viewers.
Yes, and on his immediate right is the Executive Director of the Uganda Sickle Cell Rescue Foundation, Ms. Nagawa Tracy. Welcome back for this second series. Yes, I know just last week we were talking about sickle cell and, you know, the roles of the foundation in supporting, as you call it, warriors, the children who are living with sickle cell disease. And we talked about the diagnosis and how it's important for when the child recognizes the signs of sickle cell, they first go and get tested before even concluding that they have sickle cell. You need to first get tested. So you go and get tested, and thereafter, when it's confirmed, what happens thereafter? How to take care of the child. There are two parts to it. There's taking care of the child at home, and then there's taking care of the child within a hospital setting. So I think the hospital setting, obviously, will go to our expert, Dr. Kasirye. So Dr. Kasirye, let's imagine a situation where the mother, the parents, have just learned that their child has sickle cell disease, and now they have come to you in the hospital. What will happen to them? What, you know, I know there'll be a lot of anxiety, there'll be uncertainty. Now what next? Are there operations? Are there treatments? So what happens next when you've just told the family that their child has sickle cell disease?
Thank you very much. Just to reiterate what you had earlier mentioned, is that the single most important thing to do is to have a test that will confirm whether the child has sickle cell disease or not. And so the next step, important step, is to link this patient or this child into care. Okay? Not hiding at home. So you have to get the courage to go to your pediatrician, your physician, to have that interaction on what ways forward you have for this child or this individual. And when they present to us, first of all, before I mention that, I go to that, sickle cell disease, we've appreciated that it's a disease one is born with and by and large lives with throughout their lifetime. Okay?
It's just part of them.
Exactly.
It's their genetic makeup.
Exactly.
Okay.
And so one of the critical things to do is for you, the parent or the significant other, to accept after the test that this child has this challenge and take the next step of faith and take this patient or this warrior to the physician, to the pediatrician,
to the expert in
to the expert.
Okay.
Okay.
So they come to Mulago, they go to
there are several across.
Or they go to any. You said any hospital.
Yes.
Can manage sickle cell.
Yes, I know the ministry is in the process of ensuring that the sickle cell care services are strengthened across the country. Unfortunately, we have regional referral hospitals, we have district hospitals. So all doctors ideally are informed and should have a starting point in as far as sickle cell care is concerned.
Interesting. So regarding specific treatments,
yes,
is there a cure for sickle cell? That I think ought to be the golden question.
Exactly.
Parents want to know, can the child be cured?
Exactly, like earlier mentioned, it's a lifelong challenge that our dear ones will live with. That implies that there is no definite cure within our means in Uganda.
Within our means. So there is a
in
cure
Uganda per
outside.
se. I don't want to stress on the cure, which is far out of reach, which is the bone marrow transplant, and all that also has its own challenges and risks. I want people to appreciate that there are treatments that can be given to our children, our dear ones with sickle cell disease, that will improve the quality of life that they have. And these are obtained through a chronic care setting, such as a hospital where patients or these individuals regularly come for checkups, and then identification of complications and address of those complications.
Okay, so there are specific treatments which they get in the hospital.
Perfect.
Treatments which can, I think, prevent future attacks of the the sickle cell crisis.
Yes.
Treatments which help raise the blood levels, because said their blood levels are always low.
Yes.
And then treatments which treat and prevent infections.
And address those infections or acute challenges that they come with.
Okay, very interesting. So as regards treatment, I know we haven't specifically dived into treatment, so we'll talk about the bone marrow much later on. But so Ms. Tracy, so regards treatment, not treatment, care for a child at home. Now you come from the community perspective. You're supporting the families. They have come out of hospital. Now what do they do?
Actually, most of the time, I first encourage them, do what the doctors have told them to do. That is the first thing you always have to encourage. Because if the doctor has given you drugs, or told you do this, he has told you go back on this date, or I encourage them to be, it's called adherence to drugs. Please take your drugs on time. If you don't do that, even when I tell you this and this and this, you won't change, you want to be better. So please, the first rule is follow the doctor's orders. If he has told you, go back.
Treatment plan.
Thank you, treatment plan. Your doctor's orders. Okay, treatment plan. Follow what he has told you. And he has told you, go back on Monday. Even when the baby is better, take them back on Monday. That is what I encourage them. Then besides that, I encourage them to take water. Everybody knows how water is very, very, very crucial. In sickle cell management, as doctor said the last time, their blood vessels clog. Okay, so when you take lots of water, you prevent that blood from clogging.
It makes the blood move
thank you. So that all is done. Fluids, not
so
very cold.
Thank you. All the time.
All the time, not cold drinks, but room temperature drinks or warm drinks, so that your body is always hydrated. You have to keep hydrated. That's why last year's conference that we had, we're saying keep hydrated. Yes, because we know it's the first, besides the drugs and all that, you need to always drink a lot of water. And then the other thing is eating well. We know it's a very, very, you need
important.
To feed.
What foods?
We encourage we encourage it's not really like we have specific foods, but we encourage them to have a bit of more of veggies, take your proteins in time, take your iron giving foods, those things, so you encourage a balanced diet.
I think also Dr. Kasia, the medical team also advises on the type of foods.
Yes,
are there specific foods they should avoid?
We do a whole set of counseling to empower the patient to take care of themselves at home, and also take some medication like she's earlier mentioned. So with regard to the type of foods, like she simply stated, it's a balanced diet. And a balanced diet constitutes of the bodybuilding foods, which are the proteins, from largely the different sources that we have: fish, eggs, meat, beans, groundnuts, and all that. We have a wide variety. And then we talk about the energy giving foods like carbohydrates, and then the protective foods. These are the fruits and vegetables.
Protective. Why are they called protective?
They play a role in boosting the body's immunity. A lot of fruits have vitamin C, vitamin A, and all that, basically.
So balanced diet.
Yes.
hydration.
Yes.
Follow the the treatment plan that the doctors have given.
Yeah, there's also those nitty-gritties. Please do not put the child in cold weather. When it's raining, please keep them warm. Things like let them not play a lot in the sun or run. So even when you take them to school, you need to tell the teachers. So you need to be responsible. Take time and talk to wherever is going to live with your child. If it's the maid, educate them on how to manage that child at home. Please, when it's raining, when they're overplaying, please call them, let them drink some water. You know, let them rest a bit.
They can play, but they have to also keep drinking.
Thank you, keep drinking, and also rest so that their body calms down a bit. So it's that management, and the few nitty-gritties that parents skip that put their kids back on bed before you know it. Because if they run the whole day, before you know it, at the end of the day, my knee, my back, my foot, my everything, everywhere will be paining. But if you manage them and tell them, you know what, honey, go play. But after some time, come take water. Please come and please rest a bit. It's a bit too sunny. Please encourage water. It's a bit too cold. Please go out with your sweater. Even at school, something like that. I know you want to play. I know you want to play basketball, but you know, limited time. You play basketball, but do not overdo it. Do not limit them. Don't limit them to do what they really love.
Playing.
But
just controlling the circumstances
control. Yes,
around
please. You play, but you know, take time to calm down. Do not be like anybody else. The normal ones are going to take an hour on the field. No, you don't have that. Thank you. Yes, you love music and drama. You're going to dance. Yes, but then take so they can also have a life like anybody else, but in a moderate kind of way. Let them have fun, but you know, keep it together as a parent. Yes.
You may be wondering why we are talking about drinking a lot. It's because when someone engages a lot in, you know, physical activity, too much sports or whichever activity, name it, dance, the body loses a lot of sweat and we become dehydrated.
True.
So dehydration, when the body has little water in the body, is one of the triggers of a sickle cell crisis, the sickle cell attack. And that's why she's encouraging you. The child can still play. This isn't that children can't play. They can still play, but emphasis is on hydration, to keep drinking, to follow the treatment plans, keep eating fruits, you know, the vegetables, balanced diet. All these will have a protective, additive effect on the child's life. So I think that is the main point.
Yeah,
yes,
true. Yeah.
Okay.
There's a lot to talk about.
There's much more, but at least regards the care for a child at home.
Least, a little things.
Just a bit. Well, we're almost getting there. So after the break, more about the specific treatments and how to address problems, complications which come about. You know, you have to also be aware that your child can easily suffer a complication of sickle cell. So what do you do when things start becoming a bit difficult to handle? We'll discuss that after the break. Don't go away. We'll be right back. Send in your questions on our social media platforms. Get a chance to interact with our guests in the studio, and they'll happily answer each and every question that you have. Don't go away. We'll be right back.
You are watching the Doc Talk Show.